Your kidneys could be struggling right now, and the warning signs might seem completely harmless. That little bit of swelling around your ankles you've been ignoring? That weird brain fog that hits you in the afternoon? That feeling like you just can't get enough sleep no matter how long you're in bed? Most people brush those off. They blame it on age. They say, "Oh, I'm just getting older." But here's what I need you to understand. Your kidneys don't scream when they're in trouble. They whisper. And by the time the symptoms get loud enough for most people to notice, a lot of damage has already been done. I'm Dr. William, and today I'm going to show you exactly what those whispers sound like. Because if you're over 60, this video could genuinely be one of the most important things you watch all year. Stay with me through this entire video, because sign number 4 is the one that almost everyone over 60 gets completely wrong, and it could be happening to you right now. Here's what we're going to cover today. I'm going to walk you through the 5 silent signs that your kidneys may be failing. And I'm going to explain each one in plain English, no medical jargon, no confusing lab values. We're also going to talk about why these signs get so easy to miss, especially after 60, because your body changes as you age, and some of the ways your kidneys send out distress signals actually start to look like totally normal parts of getting older. That's the danger. That's why I made this video. By the end of today, you're going to know what your kidneys actually do and why they're so critical to your overall health. You're going to know the 5 silent warning signs, including a few that will genuinely surprise you. You're going to know what to do if you think you might be experiencing any of these signs, and you'll walk away with some simple daily habits that can protect your kidneys starting today. This isn't about scaring you, it's about arming you with information, because knowledge is the most powerful medicine I know. Let's get into it. Before we get into the warning signs, I want to spend just a couple of minutes making sure you understand what your kidneys are actually doing inside your body every single day, because I think most people seriously underestimate these 2 little organs. Your kidneys are about the size of your fist. You've got 2 of them sitting just below your rib cage, one on each side of your spine. And every single minute, every 60 seconds, about 1 liter of blood passes through your kidneys to be filtered. Think about that. Your entire blood supply gets filtered by your kidneys roughly 40 times every single day. They're pulling out waste products, toxins, extra fluid, extra salt. They're regulating your blood pressure. They're managing the balance of minerals in your body, things like potassium, sodium, calcium, minerals that your heart, your muscles, and your brain all depend on. They also produce a hormone called erythropoietin (EPO) that tells your bone marrow to make red blood cells. And they activate vitamin D, which keeps your bones strong and your immune system working. So your kidneys aren't just a filter, they're a command center. Now here's the thing that makes kidney disease so dangerous. You can lose up to 90% of your kidney function before you feel sick. 90% gone, and you might not know it. That's not an exaggeration, that's the medical reality. Your kidneys have enormous reserve capacity. They compensate, they adapt, they keep working even when they're hurting. And by the time symptoms appear, things are often quite serious. That's why these early warning signs matter so much. Let's talk about them. Okay, silent sign number 1, swelling. Specifically, swelling in your legs, your ankles, and your feet. Sometimes your hands and face too. Now I know what you're thinking. Dr. William, I'm over 60. My feet swell sometimes. That's just normal. And here's where I have to be honest with you. Yes, sometimes swelling in the lower legs is just from standing too long, or sitting on a long flight, or a hot day. That kind of swelling usually goes away when you put your feet up, but the swelling I'm talking about is different. When your kidneys start failing, they lose their ability to properly balance sodium and fluid in your body. Excess sodium means excess water retention, and that water collects especially in the lowest points of your body. Your feet, your ankles, your lower legs. The medical term for this is edema, and kidney-related edema has a few specific characteristics you should know. It tends to be persistent. It doesn't fully go away overnight like normal swelling does. It's often pitting edema, meaning if you press your finger into the swollen area and hold it for a few seconds, it leaves a little dent or pit that slowly refills. That's fluid literally pooling in the tissue. It tends to get worse over the course of the day and is most noticeable in the evenings. And it might be accompanied by puffiness around your eyes in the morning, especially noticeable when you first wake up. Now, swelling can also be caused by heart problems, liver issues, and certain medications. So I'm not saying swelling automatically means kidney failure, but if you're noticing persistent swelling, especially in combination with any of the other signs I'm about to share, that is absolutely worth talking to your doctor about and asking specifically, can we check my kidney function? I know this isn't the most comfortable topic, but stick with me, because silent sign number 2 is one of the most important ones. Changes in your urination, how often you go, what it looks like, how it feels, can be one of the earliest signals your kidneys are sending you. Let me break down what to watch for. Going more frequently at night. This is called nocturia. Your kidneys normally concentrate your urine overnight, so you don't have to wake up constantly to use the bathroom. When kidney function starts to decline, that concentrating ability is one of the first things to go. So if you're waking up 2, 3, 4 times a night to urinate, especially if that's a change from your normal pattern, pay attention to that. Foamy or bubbly urine. This one surprises a lot of people. If your urine consistently looks foamy, like there are bubbles that don't go away quickly, that can be a sign of protein in your urine. Healthy kidneys keep protein in your blood. Damaged kidneys let it leak through. Protein in the urine is called proteinuria, and it's a classic early marker of kidney damage. Darker urine or blood in the urine. Sometimes kidney disease causes blood to leak into the urine, making it look pink, reddish, or brownish. This can be scary to see, and it absolutely warrants a same-day call to your doctor. Decreased urine output. If you feel like you're urinating much less than usual, and you're also feeling puffy or retaining fluid, that's a red flag combination. And burning or difficulty urinating. This is more often a sign of a urinary tract infection than kidney disease itself, but UTIs, left untreated, can travel up to the kidneys and cause serious kidney infections, so don't ignore it. The key message here is this: your urine is a direct window into your kidney health. Pay attention to changes, don't dismiss them. Now we're getting to the signs that people most commonly write off as just getting older, and silent sign number 3 might be the most common of all: persistent fatigue, weakness, feeling like your energy just isn't there anymore. Almost everyone over 60 experiences some fatigue. Life is tiring, sleep quality changes with age, and there are dozens of reasons you might feel run down. So how do you know when fatigue might be connected to your kidneys? Here's the connection. Remember I mentioned earlier that your kidneys produce a hormone called erythropoietin, EPO, that signals your bone marrow to make red blood cells? When your kidneys are damaged, they produce less EPO. Less EPO means fewer red blood cells. Fewer red blood cells means less oxygen being carried to your tissues and your brain. The result is a condition called anemia, and anemia causes profound fatigue, weakness, and difficulty concentrating. It can feel like you just can't get out of first gear, no matter how much you rest. On top of that, when your kidneys can't filter waste products out of your blood effectively, those toxins start to build up. This is called uremia, literally urine in the blood, and uremia affects your brain chemistry, your muscle function, and your overall energy levels. So the fatigue from kidney disease isn't just ordinary tiredness, it's deep systemic exhaustion that doesn't fully respond to rest. It might come with difficulty concentrating or brain fog, weakness in your muscles, feeling cold when others feel fine, which is a sign of anemia, and shortness of breath with even minor activity. If you've been telling yourself, "I'm just getting older" about your energy levels, please consider asking your doctor to check your kidney function. It's a simple blood test, and it could tell you something really important. All right, we're about halfway through, and I promise what's coming next is the part that most people completely miss. Sign number 4 is something that almost every person over 60 experiences at some point, but almost nobody connects it to their kidneys, and the research on this one is genuinely startling. If you haven't subscribed yet, do it right now because I make videos like this every single week, and trust me, you don't want to miss what's coming. Hit that subscribe button, and let's keep going. Here it is. The sign almost nobody connects to their kidneys. Persistent itching, dry, irritated skin, sometimes a rash. I know you probably weren't expecting that. Most people think of skin issues as a dermatology problem, not a kidney problem. But here's the science. When your kidneys fail to remove waste products from your blood, those waste products, including phosphorus and urea, build up to levels that your body can't tolerate. And your body tries to compensate by pushing some of those toxins out through the skin. The result is chronic itching, medically known as uremic pruritus. It's one of the most frustrating symptoms of kidney disease because it doesn't respond to normal anti-itch creams. It can affect large areas of the body, it tends to be worse at night, and it often comes with dry, dull-looking skin that just doesn't seem to heal the way it used to. This kind of itching is often dismissed as dry skin, especially in older adults who frequently experience dry skin anyway. People buy more moisturizer, they switch soaps, they take antihistamines, and none of it really works because the problem isn't at the surface, it's in the blood. There's also a condition called calciphylaxis, which is less common but more serious, where calcium deposits build up in small blood vessels under the skin, causing extremely painful skin changes. This is specifically associated with kidney failure and is a medical emergency. Now, most people with kidney disease don't get calciphylaxis, but if you've had unexplained persistent itching for months, especially combined with any of the other signs on this list, that's worth discussing with your doctor. Specifically ask, could this be related to my kidneys? Our fifth and final silent sign actually encompasses two things that are deeply connected to each other and to your kidneys: shortness of breath and high blood pressure. Let's start with blood pressure. Your kidneys play a central role in regulating blood pressure. They do this in a few ways: by managing fluid volume in your body, and by producing hormones that directly affect how tight or relaxed your blood vessels are. There's a system called the renin-angiotensin-aldosterone system. Don't worry about the name, but it's essentially a hormonal control loop that your kidneys operate to manage blood pressure. When your kidneys are damaged, this system can go haywire. The kidneys might start producing too much of certain hormones, causing your blood vessels to tighten and your blood pressure to spike. Here's the vicious cycle. High blood pressure damages kidneys, and damaged kidneys cause high blood pressure. It goes both ways. This is why hypertension, high blood pressure, is both one of the leading causes of kidney disease and one of its symptoms. If you have high blood pressure that's been difficult to control, even with medication, or if your blood pressure is suddenly harder to manage than it used to be, that's worth exploring in terms of kidney function. Now for the shortness of breath. As kidney function declines, fluid can accumulate in the lungs, a condition called pulmonary edema. This makes breathing feel effortful, especially when lying flat. You might notice you're waking up in the middle of the night feeling like you can't catch your breath, or that you need to prop yourself up on extra pillows to sleep comfortably. Additionally, the anemia we talked about earlier, reduced red blood cells, means your body is getting less oxygen with each breath. Your heart and lungs have to work harder to compensate. That leads to shortness of breath with everyday activities: climbing stairs, walking across the parking lot, things that didn't used to wind you at all. Now let's talk about who is most vulnerable, because if any of these apply to you, you need to be especially vigilant. Diabetes is the #1 cause of kidney failure in the United States and many other countries. If you have diabetes, even well-controlled diabetes, your kidneys need regular monitoring. High blood pressure is #2. We just talked about that cycle. If you've had hypertension for years, your kidneys may have been quietly taking a beating. Age itself is a risk factor. After 60, your kidneys naturally lose some filtering capacity. They become more vulnerable to damage and less efficient at recovering from stress. Cardiovascular disease, heart disease, and kidney disease are deeply linked. They share risk factors and often occur together. And obesity, smoking, a family history of kidney disease, and certain medications, including some over-the-counter pain relievers like ibuprofen and naproxen taken regularly, can all damage kidneys over time. If you have one or more of these risk factors, please don't wait for symptoms. Talk to your doctor about getting a baseline kidney function test. It's called a GFR, glomerular filtration rate, and it's a simple blood test. Combined with a urine test checking for protein, it gives your doctor a very clear picture of how your kidneys are doing. Okay, so what do you actually do if you recognize some of these signs in yourself? Step 1. Don't panic, but don't wait either. Having one of these symptoms doesn't mean you're in kidney failure, but it means you need to find out what's going on. Step 2. Call your doctor and be specific. Don't just say, "I'm tired." Say, "I've been experiencing fatigue, some ankle swelling, and I've noticed my urine looks foamy. I'd like to get my kidney function checked." That specificity helps your doctor act appropriately. Step 3. Ask for these specific tests: a serum creatinine test, a GFR calculation, and a urine albumin to creatinine ratio. These three together give a comprehensive picture of kidney health. Step 4. Bring your medication list. Some medications, including common ones like NSAIDs, certain blood pressure drugs, and some antibiotics, can affect kidney function. Your doctor needs the full picture. Step 5. Follow up. Kidney disease is often managed very successfully when caught early. Early intervention can slow or even stop progression, but it requires action on your part. Let me leave you with some practical, positive actions, things you can start doing today that are genuinely protective for your kidneys. Drink enough water. Not excessive amounts, but enough to keep your urine a pale yellow color. Dehydration puts significant stress on your kidneys. On a typical day, most adults need about 6 to 8 glasses of water. More if you're active or it's hot. Limit sodium. High sodium intake raises blood pressure and forces your kidneys to work harder. Start by reducing processed foods, canned soups, and restaurant meals. Those are where most of the hidden sodium lives. Control blood sugar. If you have diabetes or prediabetes, blood sugar management is the single most important thing you can do for your kidney health. Even small improvements in blood sugar control have measurable benefits for the kidneys. Move your body. Regular moderate exercise helps control blood pressure, blood sugar, and body weight, all major kidney protective factors. Even 30 minutes of walking 5 days a week makes a meaningful difference. Avoid excessive over-the-counter pain relievers. Ibuprofen, naproxen, and similar anti-inflammatory medications used occasionally for normal aches and pains are generally fine, but taking them daily or in high doses over long periods is genuinely damaging to kidneys. If you find yourself needing pain relief that frequently, talk to your doctor about safer alternatives. And don't smoke. Smoking reduces blood flow to the kidneys, worsens blood pressure, and accelerates kidney disease progression. If you currently smoke, this is one more powerful reason to quit. I want to take a moment to talk about something that I think is really important, and that's the power of catching this early. Chronic kidney disease is staged on a scale from 1 to 5 based on how well your kidneys are functioning. Stage 1 and Stage 2, when the kidneys are still functioning at 60 to 90% or better, are almost always completely reversible or highly manageable. Most people at these stages can live full, completely normal lives with some lifestyle changes and monitoring. Even Stage 3, which is moderate kidney disease, is something that many people manage for decades without progressing to kidney failure, provided they get the right care, control their blood pressure and blood sugar, and make some lifestyle adjustments. It's Stage 4 and Stage 5, severe and end-stage kidney failure, where we get into dialysis, transplants, and serious quality of life impacts. And the number one reason people reach those stages? Not catching the disease early enough. You now know the 5 silent signs, you know the risk factors, you know what tests to ask for. That knowledge puts you ahead of millions of people who are walking around right now with no idea their kidneys are struggling. Use that knowledge. Please. Let's do a quick recap so these stay with you. Silent sign number 1. Swelling in your legs, ankles, feet, or face, especially persistent or pitting edema that doesn't go away overnight. Silent sign number 2. Changes in urination, frequent nighttime trips, foamy or bubbly urine, blood in the urine, or changes in output. Silent sign number 3. Persistent fatigue and weakness, deep systemic exhaustion that doesn't respond to rest, often combined with brain fog and feeling cold. Silent sign number 4. Persistent itching and skin changes, itching that doesn't respond to creams or antihistamines, especially widespread or nighttime itching. Silent sign number 5. Shortness of breath and difficult to control high blood pressure, especially shortness of breath that's worse lying down, or new breathing difficulty with normal activities. Write these down, share them with someone you love. These 5 things could change a life. I want to finish today by saying this. You watched this video for a reason. Maybe something resonated. Maybe you recognized a symptom in yourself. Maybe you're watching because someone you care about is dealing with kidney issues, and you want to understand it better. Whatever brought you here, I'm glad you stayed to the end, because that means you take your health seriously, and that is the most powerful thing you can do for yourself. Your kidneys work every second of every day to keep you alive. They deserve your attention. They deserve to be checked. And if they're struggling, they deserve to be caught early when there's still so much that can be done. Talk to your doctor, ask for the tests, take the steps. Now, if this video helped you, here's how you can help me reach more people who need this information. First, hit that subscribe button if you haven't already. I'm posting health videos like this every single week, information you can actually use, explained in plain English without all the medical jargon. Second, hit the like button. It tells YouTube that this information is valuable, and it helps get this video in front of more people who might need it. Third, drop a comment below. Tell me, which of these 5 signs surprised you the most? I read every single comment, and I love hearing from you. And fourth, share this video with someone over 60 in your life who you think should see it. A parent, a spouse, a friend. This might be the video that prompts them to get a checkup that changes everything. I'm Dr. William, and I'll see you in the next video. Take care of yourselves.